This is an example of how the Harvest to Invest program can and did work for an Ahead customer. We were engaged with a large healthcare system. They operate 14 different hospitals and a number of different campuses with infrastructure throughout. They had grown through mergers and acquisition of a number of different organizations to evolve to their current form. They had a number of different branch office locations, as well as 4 core data centers. They were in the process of looking to consolidate, standardize, and modernize, and they wanted to understand what assets they could continue to leverage versus what things that didn't make as much financial sense for them. Concurrently, they were looking at a large Epic application upgrade that was driving incremental infrastructure requirements, as well as several other projects that were going to force them to acquire additional hardware and associated software licensing. First, though, they wanted to know exactly how much they had to go out and acquire versus what they could leverage that was already in their inventory. So we started with them with an analysis of their current networking, compute, and storage equipment, as well as their software licensing, including backup and recovery, asset firmware, and virtualization software. We helped them build out a full total cost of ownership of their current environment, including what assets they could leverage for some of those new projects. From there, we created cost models of the incremental purchases they would need to support those application projects, as you see here. We were then able to work with them to model out a number of different options across timing of purchases, volume or bundled purchases, as well as payment vehicles. And after more than 20 iterations, we have here the final result that made the most sense to them, given their needs and constraints. We've highlighted the net impact down in the client savings table. Over a 5-year period from fiscal year 18 to fiscal year 22, we were able to identify a $15.8 million cash savings versus their current trajectory. More importantly to their finance team was the $6.4 million GAAP savings this represented. This was a meaningful amount not just to the IT team, but also to the overall enterprise. This model was vetted and validated by the CFO and allowed the organization to accelerate some of the IT projects that had previously stalled, because they now had the compelling financial business case and plan. That plan allowed them to gain visibility for their projects across the entire portfolio of the hospital's projects. When you think about hospital projects, they're adding parking lots, new wings, surgical theaters, and even considering more acquisition rates. These projects each have a projected ROI. IT doesn't always expose those same metrics, and this analysis gave this IT organization a seat at the table where they were able to have those same conversations. If you're interested in starting your own assessment, please visit thinkahead.com to learn more.